Hi and welcome back to the channel. Today we're going to look at a twisted ankle. In today's video we're going to see a case of a patient who suffered a twisted ankle and she was having a lot of pain. This had been over a month before she came to see me. This was not the first time that the patient had twisted and even sprained her ankle. She'd done that several times before, so we know there's a problem there with that ankle. But what brought the patient to the clinic was that she was in a lot of pain and that after 1 month she still hadn't seen major improvements. This will be a very interesting treatment because in this treatment I used a combination of Master Tung points with cranial acupuncture points and bloodletting techniques. So come with me and let's analyze this case. If you'd like to learn more about the techniques that I talk about in my videos, check out the courses I have available. I have courses in Portuguese and in English, so check them out in the links below. In these courses I teach the balanced method to treat pain. This is a technique where you get instant relief in most pain cases, so if you want to learn about it, check them out. This was a 60-year-old female patient, and this patient twisted her left ankle. This is something that had happened to her before, and every time that it happens it tends to be worse and worse and worse, as it is to be expected. In this case the patient stepped wrong while she was doing a walk during her vacation and she twisted the ankle. It immediately swelled up and she told me that she even had problems wiggling her toes after this. But after icing it and resting it, in a few days the swelling went down, the movement in her toes came back, but she was still in a lot of pain. This was over a month before she came to see me. When I saw her, she had pain on the lateral side of the ankle coming almost all the way to the toes. So what we in Chinese medicine might say more or less from the stomach line all the way to the bladder line, from the ankle almost to the beginning of the toes. It would hurt when she walked, so just putting weight on her foot was enough to get her to have some pain, and it was worse if she forced her foot to straighten or to bend it to the inside. It hurt enough that she was limping when she came to the clinic. Looking at this, the first thing that I thought was to use bloodletting, because especially if it's a repeated injury, we're probably going to find some areas to bleed. And for this I started looking in the area of her lateral ankle, but I didn't see anything major to bleed. Then I went up mainly in the area of the gallbladder and focused particularly in the area of gallbladder 34. In this area I could find some veins, and I did bloodletting in one of the veins. Bloodletting is an amazing technique that I use a lot in my clinic, so if you're not comfortable with bloodletting, check out this video that I already have on the topic, and if you have any specific questions, just leave them in the comments and I'll answer all your questions. So I did this on the same side as the pain, and as the patient was lying down in the table, I asked her to do the movements that usually cause her pain. And just by bloodletting this area, the pain went down by about 50% according to the patient's description. I said, okay, perfect, we're starting to see results, we're taking the stagnation away, because it's very important when we have an injury, especially something like this that happened repeated times along the years, there's always going to be stagnation, so I always like to start with bloodletting to release this stagnation. And from then on I'll go into acupuncture. So then I went into acupuncture using a Master Tung point. And I went to look on the opposite hand and I used a point called Huai Ling. This is unfortunately another of the points that is not numbered, so that is not in most translated books. I learned this point studying Dr. Who's approach to Master Tung acupuncture. And this point is amazing for the ankle, or as you can probably imagine, if I tell you that Huai Ling can be translated to ankle efficacy. This point is located right at the thumb joint. It has the shunjing of the lung and is mostly used for ankle pain, sometimes can be used for shoulder pain. I added this point and asked the patient again to try the movement, and the patient told me that while she was moving the foot there was no longer any pain. As I didn't want the patient to be walking around right then and there, I just went to her foot and with my hand I forced the movements a bit more than she could do just on her own. And when I was forcing it, she told me, well, at the very last bit of the range of motion, she could still feel some pain. So I decided to add 2 scalp acupuncture points. So I added VPF from Scalp Acupuncture. This means vertex perineum foot. So this point can treat anything on the vertical line from the point all the way to the ground. So it's a great point to treat foot problems. And I also added the foot motor and sensory area from Chinese Scalp Acupuncture or from Shunfa acupuncture. This is also an amazing point to treat the foot. And according to what Dr. Jiao told me, this point can also be used to increase the efficacy of the other points that you're using, so as an add-on to the other points. And so I also used the foot, motor and sensory area, this one on the opposite side of the pain. And I went again to the foot of the patient and I tried the stretching and the bending of the ankle, and there was no more pain. So I let the patient rest with the needles for 30 minutes, and by the end I took the needles out and asked the patient to walk a little bit around the office, and there was no more pain. The patient was flabbergasted because there was no more pain even when she was walking bare feet, which was harder for her than when she was wearing shoes, and she couldn't find the pain. The patient asked me several times, well, but is this normal that the reaction is so quick that I'm without pain? She was thinking that it was all in her head because she couldn't fathom how the result was so quick. This is particularly funny because the patient had already done acupuncture with other practitioners and she liked it, she had good results. But from what she told me, none of them used Master Tung or bloodletting techniques, and she wasn't used to how quick these techniques can be. She was really surprised and she was very happy with the results. I'm going to see her again next week. I'm expecting that some of the pain will come back and that we'll have to do maybe 2 or 3 more treatments, but she already left the office without any pain and she's very happy with the results. This case is very interesting to me for 3 reasons that I want to highlight here to you. First is the efficacy and quickness of these techniques. Even for patients who have previously done acupuncture with good professionals and the patients were happy with their results, they still get surprised by how quick these methods work, especially when we're talking about pain. And this is what I've been screaming from the rooftops for the last 10 years and trying to teach to every acupuncturist I meet, because for pain treatment, these techniques, in my opinion, are the best. And a very important thing with these techniques is they're quick, which allow you to convince the patient in the first session. Even if you combine them with different techniques, even if it's a longer treatment that maybe you'll need 5, 10, 15 sessions, if the patient sees results from the first session, now he trusts you. He knows you know what you're doing, and that's why these techniques are so important in my opinion. Then the other important thing is the use of bloodletting. Bloodletting is an amazing technique, especially when you have stagnation, which always happens when you have repeated injuries. So if you're still not working with bloodletting, think about adding this to your work tools. I've already advised Dean Musher's book on bloodletting called The Complete Guide to Chinese Medicine Bloodletting, but more than that, I advise you to take a course with someone who is good with bloodletting because it will change your practice. And finally, call attention to another amazing Master Tung point that unfortunately is not present in most of the translated books, which is Huai Ling. This is an amazing point to treat any kind of ankle problems. Thank you so much for watching. If you like this video, don't forget to like and subscribe to the channel and share this video with anyone that might benefit from it, and I'll see you in the next one.